cases of a new coronavirus rising and concern growing over the spread, comparisons are being drawn the deadly SARS outbreak in 2001. Both are strains of coronavirus, and virologists say the current strain, 2019 nCoV, is a close relative to SARS. But how similar are the two diseases, and what can we expect to happen? Where did they originate? Both illnesses originated in China and are believed to have been first transmitted in wet markets. Coronaviruses are zoonotic diseases, which means they can jump from animals to humans, especially in locations where humans and animals are in close proximity. Chinese scientists believe the new coronavirus, dubbed the Wuhan virus, could have been transmitted by bats at the seafood market in the city of Wuhan. SARS is thought to have been transmitted from one species of animal, potentially bats, to civet cats, which then infected humans at a market in the Guangdong province of southern China. The number of cases of the Wuhan virus could be far higher than reported, as those with milder or no symptoms may not have been tested for coronavirus. Some researchers have suggested the real figure is 100,000 cases or more. There have been no confirmed cases of SARS since 2004. Both diseases have been concentrated in China, although managed to spread after people traveled from China to other countries. The magnitude of an outbreak depends on how easily the virus can spread. Although research is still at early stages, some studies estimate each individual with the Wuhan virus could infect on average 2.6 people. This makes it as contagious as SARS. How fast a virus spreads can also be affected by its incubation period, the time between being exposed to the virus and the onset of symptoms. As the Wuhan virus has a longer incubation period than SARS, and it can be passed on before a person experiences symptoms, it is harder to contain. SARS patients were largely isolated as soon as they became contagious, when symptoms began to show, and therefore it was easier to trace others they may have come into contact with. Deaths from the Wuhan virus have been concentrated in mainland China, with only one confirmed case outside China, in the Philippines. The death toll from the new coronavirus in mainland China has exceeded the deaths from the 2002-2003 SARS outbreak, which killed 349 people in mainland China and 299 in Hong Kong. However, 16% of deaths from SARS occurred outside China and its administrative regions. With the possibility that the number of cases is actually far higher than reported and a rise in the number of recoveries, the fatality rate of the Wuhan virus could be much lower than currently reported. In the 20 days since cases of the Wuhan virus started being recorded, the World Health Organization, WHO, declared 530 of those infected had recovered. In comparison, 1,706 people had recovered from SARS after 95 days during the 2003 outbreak. Who were the victims? Most of those killed by the Wuhan virus were over 60 and many had pre-existing health conditions, but at least 5 victims under the age of 60 have been recorded. Similarly, SARS deaths were largely recorded in older patients and those with underlying health conditions. According to a WHO report from May 2003, less than 1% of those killed were under the age of 24, and up to 6% of 25 to 44-year-olds who were infected died. Can the viruses mutate? Both the Wuhan virus and SARS are believed to be mutations of a strain of coronavirus found in small mammals. Some researchers fear the new coronavirus could mutate again so that it spreads more efficiently or becomes more harmful. However, mutations do not necessarily make a virus more virulent. A 2018 study of SARS in primate cells found a mutation of the 2003 outbreak is likely to have made the virus less harmful. What was China's response like? Chinese authorities were heavily criticized for their response to the SARS outbreak after they attempted to cover it up. Patients were kept in hotels and driven around in ambulances in order to hide the true number of cases. It took officials at least 4 months to institute any quarantine measures. China says it has since learned its lesson and has made sharing information a priority. Authorities have reacted by locking down Wuhan and more than a dozen other cities across Hubei province, restricting the movement of 56 million people. Has a vaccine been developed? There is not currently a vaccine available for either SARS or the Wuhan virus. A vaccine was prepared for human trials following the SARS outbreak, but it was never needed as the virus was able to be contained. As scientists have already worked on vaccines for other strains of coronavirus, including Middle East Respiratory Syndrome, MERS, there is optimism a vaccine for 2019 nCoV could be developed by the summer. Virologist Professor Paul Kellam previously told Sky News, if everything moves smoothly, it takes 3 to 6 weeks to get to the point where you can start testing, then you look to see if they can raise an immune response, normally in an animal. You won't start to get human studies until about the beginning of the summer, probably July. But it's a bit of a movable feast. If the Wuhan virus is not able to be contained and a vaccine is not developed, it could become endemic, meaning deaths would occur each year as the virus circulates. But with scientists still trying to record more accurate data on the latest outbreak, there is not yet solid evidence as to how severe and contagious this strain of coronavirus is, and whether it could be as deadly as the SARS pandemic. Subscribe this channel. With cases